Lesotho, a tiny and impoverished mountain kingdom in southern Africa. It is home to about 2 million people. In Lesotho, more than 1 in 4 young adults has HIV. Some 20,000 infants and children are also infected. The average life expectancy is 34 years. Lesotho is a place in desperate need of help. Dr. Edith Mahapi and her daughter, Dr. Dineo Tahane, are on a journey of sorts, one that has turned out to be both very personal and highly professional. In a way, it has taken them home to Lesotho.
I was born and raised in Lesotho. Grew up here, went to school through high school, went to medical school in England, worked at Georgetown University, seeing patients there for many years in the United States. Then came back and worked in Lesotho.
I was born and grew up in the United States. I had the chance to come and visit quite often and got to see how different things were in terms of healthcare here in Lesotho compared to the United States.
Globally, children represent 16% of all AIDS deaths. Most die before their 5th birthday because the disease progresses more rapidly in the young. In fact, a child dies of AIDS every minute of every hour of every day somewhere in the world, and mostly in Africa. In Lesotho, until June 2005, treatment for children was virtually non-existent.
The situation was quite dismal because of a lack of pediatricians and people knowledgeable in treating children with HIV. Nobody really was doing much.
Edith and Dineo decided to come to Lesotho to do what they could to help treat HIV-positive children and their families.
I moved back to Lesotho because I felt that I wanted to come and help.
On World AIDS Day 2005, the first medical center dedicated to caring for HIV-infected children in Lesotho opened its doors, with Edith as its director. The Baylor Bristol-Myers Squibb Children's Clinical Center of Excellence, Lesotho, is funded by Bristol-Myers Squibb's Secure the Future program. Operated by Baylor College of Medicine in partnership with the Lesotho government, it's one of 3 treatment centers for children that Secure the Future has established in Africa, with 4 more to be added to the network.
When we first opened, only a few children came, of course, and those patients were really, really sick.
These are children who had not received any treatment with antiretrovirals before the clinic opened, so a lot of them were chronically ill.
At first, about 25 children a day sought help at the center. Now, the center sees 3 times that number each day.
We are seeing anywhere from 60 to 85 children every day.
Some of the children that we've seen from the beginning are now going to school. They're now much healthier and happier.
Dineo arrived in November 2005 as a member of the world's first pediatric AIDS Corps, created by Bristol-Myers Squibb and Baylor. Some 50 doctors a year expect to treat 80,000 children through the Children's Clinic Network over the next 5 years. In its first 10 months, the Lesotho Clinic had seen over 1,000 children, a quarter of whom are on ARVs, and more than 600 of whom are still being monitored regularly. What's more, the Pediatric AIDS Corps doctors are providing yet another critical resource, training other healthcare professionals to treat and care for HIV-infected children in rural areas of Lesotho. The goal is to reach as many of the HIV-positive children as possible in this tiny kingdom in southern Africa.
It will have a tremendous impact in terms of building local capacity and training health professionals in each of these countries.
An important part of treating children with HIV is to counsel, test, and treat their parents and siblings as well. The Lesotho Center now serves as a family clinic to treat the entire family. For Edith and Dineo, the power and significance of coming home has changed not only their lives, but the lives of countless children living with HIV.
Think about what would have happened or what might happen if these children didn't have a place to come. If we weren't here, what would have happened to this child?
Knowing that I'm making so much difference to so many people who would not have had that chance had I not been here working, especially with the lack of pediatricians in Lesotho. One cannot sit back and say somebody will take care of it. But it's up to all of us to do our part.